Our goal relative to this project was to create a facility that was designed through the eyes of a child and that would support our clinical services that are being utilized by a growing number of children that are coming through our doors on a day-to-day basis.
One of the things that really impressed me about Welty was the degree to which they identify with the mission of Children's Hospital. We're a very mission-oriented organization, and everything we do is about how we can provide better service and better care to patients and families. Welty's entry into that culture was totally seamless. They get it in terms of what makes Akron Children special and what we really wanted out of this project.
When you're really committed to treating every child as if that child's your own, you're going to want to get the best return on the dollar you're investing in that child. And that brought us to integrated project delivery. We had not done that before. We had been on the lean journey, and this was a natural progression from that, from an operational standpoint, into a building project.
We looked at Welty as a partner who was very interested in working on IPD with us. They didn't have a lot of experience in IPD, and we had zero, but we really felt the commitment from the senior leadership team, starting with Don Taylor, through the rest of the senior leaders at Welty, that this was a project and a project delivery method they really wanted to try.
We were really attracted to the idea of what is, for this area, the first integrated project delivery project of its type. I mean, there is nothing else in the state of Ohio, and we've since learned that it's really one of only 3 or 5 true IPD projects in the entire country. So having the opportunity to be innovative and collaborative and use these communication skills that we had been developing on how to make projects work better was really, really exciting.
In my 45-year career in healthcare, I've been involved in 6 major building projects. The first 5 were all conventional projects. In this project, it's an integrated project delivery process. And I can tell you, without question, I would never go back to the old way. The way it unites the team, the way it brings collaboration to the table, the way it brings the best out of everybody, it's the way to do it. And I'm pretty excited about it.
Welty and Children's really had the same goal on this project, and that's to deliver value to our patients and families. So from the beginning of the project, when we started out at an estimate of $242 million, Welty worked with us to actually help drive the cost down with the design team during the design phase, and then they worked with us during the construction phase to actually drive the cost down even further. Right now we're looking at a cost of around $178 million. So that's quite a significant difference from $242 million. And we had actually added scope in as well to that $178 million. So it was actually delivering more than we had originally asked for.
What we've been able to do relative to bringing a project in that initially was being talked about around $240 million, and we're bringing that project in at a target price of $180 million, haven't cut anything out of the project, and we're also right now ahead of schedule and below that target. I'm so proud of that.
Welty was a key stakeholder in the success we've had with the integrated project delivery design process. And I'd like to see Welty on any future projects for Akron Children's Hospital.
We've had a wonderful relationship with Welty Construction. There's an alignment in their philosophy, their values, with the 125-year values and mission and heritage of Akron Children's Hospital. That makes a difference. It truly makes a difference. They spend the time to get to know who we are. They spend the time to get to know our mission. They spend the time to understand what designing and putting a building together through the eyes of a child is all about. And they've gone the extra mile. They truly have gone the extra mile. And they do everything they can to make sure that this investment is an investment we're all proud of.
I would, without hesitation, bring Welty to the table again to work with us on future construction projects. And I also would recommend Welty highly to any other health system. That level of collaboration, the level of transparency, the communication, the engagement of the organization from the top down. I can't imagine another construction manager bringing those skills and values to the table in the way that Welty has.
Welty is an innovator. We've learned from them in terms of what they do and how they do it. They want to be the best. We want to be the best. The children we take care of, they deserve us being the best. And that's part of a pretty successful formula.